Tell us about what transcranial magnetic stimulation therapy is and how it works on the brain.
It is a non-invasive neuromodulation of the brain. In a depressed brain, certain circuits in the brain become underactive or dysregulated. That repetitive stimulation of the magnets that we deliver with the TMS machine provides a wake up and a rebalance of those networks. So it's teaching your neurons how to fire correctly when they've been underactive, increasing the brain's neuroplasticity, the brain's ability to reorganize and form new neural connections. So essentially is your brain's ability to rewire itself. And it's like physical therapy for the brain.
Welcome to the Forward Think Tank Podcast, a place of hope, inspiration, and education around holistic health and healing. I'm your host, Jamie Mazza, a holistic health coach, mental health advocate, and dancer. Join me as I share out-of-the-box conversations with integrative doctors, healers, and exceptional forward-thinking individuals thriving on the other side of their health challenges, as well as stories from my own personal healing journey. Thank you for tuning in. I'm so happy you're here. Hello, everyone. Welcome back to the Forward Think Tank. Today, I am joined by one of my best friends, the brilliant Hannah Lynch. Hannah is a board-certified psychiatric nurse practitioner, and she is the owner of Onward Psychiatry. Today, I am so excited, Hannah, to be picking your brain and talking about all things related to this fascinating new therapy that I have recently learned about since Hannah's incorporated it into her practice, which is called Transcranial Magnetic Stimulation therapy. And this is something that can provide relief for mental health symptoms like depression, anxiety, and more. And it's something that can be done without medication. And I feel like this is such an important conversation to have. So I'm so excited to have you here, Hannah, so we can talk about all the things, talk about your practice, and you can share your expertise with us. So thank you so much for being here.
Thank you for having me. I'm so excited to be here. I know we have been best friends for a long time, but I am an avid listener of the podcast and I love all the information that you put out there. And I am just so honored to be in the invite list of all the incredible guests that you've had on so far. Everyone's been so inspiring and I've learned so much. So I'm just very honored to be here and excited.
Thank you. Honestly, that means the world to me. I know when I started this podcast, I really wanted it to go beyond the world of cancer. And I think going through this whole process, I've realized how important it is to take care of my mental health. And it's something that I've always been a big advocate on, and just seeing everything that you've done in your work and, you know, a business owner and having your own practice and incorporating things like this into what you do and how you help people heal is something that I honestly am so intrigued about. So I really want to dive into this and help you share this with the world, because I just, when you said, yeah, it's something that can be done to help people without medication, I think there are so many people out there looking for solutions to really help them move the mark when maybe medication isn't doing it, or they're looking for other ways to really help themselves. So I want to dive deep into this. So let's get started, girl. Can you share a bit more about your background and what led you to become a psychiatric nurse practitioner?
Sure. So we met at University of Buffalo. I started there as a nursing major. I think I just always knew that I wanted to get into patient care, caring for people, doing something that wasn't like a traditional desk role job. I was pretty immature back in our UB days, or at least, when I first started, and I just wasn't ready for the course load that was the nursing major. It was very intense. My first year before I had met you guys, you and, all of our best friends, my first year was really intense and I just wasn't ready for the work. So I actually switched my major to psychology and became very interested in psychology. And that was my major throughout my time at UB. There's not really much you can do with an undergrad psychology degree, unfortunately, but I used that bachelor's and got myself an admin job at Fidelity, which got me to Boston. And just like I had known when I was, 17, 18, the office life was not for me. Just sitting at a desk all day, didn't do it for me. I hated it. So I decided to give nursing school another try. I was ready for it that time. I put in the work. I did really well. I fell in love with it like I knew that I would. And I was pretty dead set on becoming a labor and delivery nurse. That was what I had always wanted to do. The birthing process is fascinating to me. I love babies. So that was when I had graduated. That was on my mind, but I couldn't get a job anywhere. Boston hospitals are extremely competitive, and I had gotten an associate's degree in nursing first off. So I was actually hired at a mental health hospital. I had to get hired somewhere. I couldn't get hired anywhere else to be a floor nurse, a labor and delivery nurse, nothing because of that associate's degree. So I got hired at a mental health hospital thinking it would be kind of like means to an end. As I went to get my Bachelor of Science in nursing, I would work on this floor, pay my bills, and then keep it moving. Little did I know I would fall in love with it. I fell in love with mental health. I grew an understanding of it that I didn't have before. A childhood best friend of mine actually passed away after her long battle with addiction. And at the time, I was working on a dual diagnosis unit, which is addiction paired with a mental health diagnosis. And, at that time, I wasn't sure if I was going to be able to return to work because I thought it would just hit too close to home when I was grieving that loss. And it actually ended up saving me. It was so therapeutic. It became my passion. And I knew that this was my calling, and labor and delivery was behind me. So I finished my bachelor's. I wanted to just be able to make and evoke change in mental health. And I knew I needed to get an advanced degree to keep going and to make that possible. So I went to school to become a nurse practitioner and continued to fall in love with mental health and psychiatry. And that led me to work in private practice. And also at the same time, I was working on an inpatient eating disorder unit, which I have a vested interest in now and specialty in now, and then opened my own practice a couple years after that. So it's kind of just evolved naturally, which has felt really good and really authentic for me.
I love it. Thank you for sharing that and painting the picture. I also think it's important for people to hear that, being 18 years old, I mean, we were all in a completely different mindset. And sometimes you need to, take things as they come and see where life guides you, but also having that innate knowing that you always wanted to make a difference in people's lives. And you saw yourself eventually getting into nursing. And then that all kind of came full circle. And then finding the path of helping people with mental health and how your own life experience helped shape that direction is something, it's a common theme that I often hear as I interview people on this podcast. It's like a lot of what happens in our life helps us kind of just determine what comes next and where the right steps are and what, maybe that divine guidance is leading us into. So I know just from talking to you as one of my best friends, but also, like having that therapeutic lens, you are somebody who you create such safe space for people. And the fact that you've created your own business with all of this, I, see some of the testimonials you've shared on your site. I know what a difference you're making in people's lives. And I know that this is the category that you are really meant to be working in. So I'm always so proud of you. You continue to impress me, honestly. So can you talk a little bit prior to bringing the TMS system into your practice? Were you seeing success in people's healing from things like depression and anxiety? And what, if anything, was moving the needle in their healing process?
So the short answer, we'll get into the long answer, obviously, but the short answer is yes. I was seeing success with the treatment modalities that I was using for depression and anxiety. I treat a vast range of psychiatric disorders, but commonly anxiety and depression are the most that I see, and what people seek care for the most, I would say. So in school, we're taught psychotherapy and psychopharmacology. So my role as a nurse practitioner is primarily to prescribe medications. And then I do kind of sprinkle a little bit of psychotherapy in my appointments. But on top of that, I always encourage my patients to also seek out psychotherapy from a licensed therapist as well, that they would be seeing more often than myself. So my primary role is medication management. So I've seen incredible results with prescribing medication with depression and anxiety, but it's a loaded question because there are so many symptoms of depression that I think a lot of people that maybe don't have a family member or friend that suffered from it, or they haven't suffered from it themselves, don't understand. A lot of people think that it's just blanketed sadness, you're just sad,
Right.
which is just such a stigma towards it and such a misunderstanding. There are so many symptoms that go into it. We use like a mnemonic for the symptoms called SIGI caps, and it kind of encapsulates some, not all, of the symptoms that contribute to depression, which is like sleep disturbance. That's the S. I is interest. You usually lose interest. You have anhedonia, things that brought you joy before just kind of fall flat, don't do the same thing. Loss of energy. That's the E. Sorry, I skipped G, which is guilt, having feelings of guilt for no reason, a loss of concentration, loss of appetite, psychomotor symptoms, whether you're agitated, moving more than you normally would, or moving slower than you typically would, kind of like feeling like you're moving through mud, and suicide, be it attempts or thoughts. And so all of those fall into the symptoms. And so a lot of the times when you prescribe medication, it can help with one or two of them. Sometimes all, sometimes we hit the nail right on the head and it helps with all of the symptoms, but sometimes it doesn't. Someone will take the medication and they're saying, I'm sleeping better, which is good, or I'm not sleeping as long, so I have a little bit more energy, but they're still feeling flat, things aren't bringing them joy, or their mood is improving, they're feeling a little bit lighter, able to feel joy, but their energy and motivation is still not there. So when that happens and you're at a max dose of a medication or you're increasing the medication and things aren't happening, a lot of the times what happens in psychiatry is you start to add more medications on as like an adjunct therapy. So it's going to treat those symptoms that the first medication isn't addressing. And for a lot of people, that feels really, really bad. They don't want to be on multiple medications. Also, introducing more medications means more side effects as well. So, I mean, it's a loaded question as far as like, have I seen success? Because I certainly have. And I certainly have seen success when I do add adjunct medications, but I've also seen people not respond. And I've also seen people respond but have side effects. So it's like, it's such a loaded question. And then as far as like moving the needle on healing, yes, medications certainly play a role, but I would say my patients sometimes tire of me getting on my soapbox of medication will never take you 100% of the way. And I don't think any therapeutic modality really would. It's like, it's a combination of things. So like I said, when I have someone come in for medication management, I harp on them to get a therapist. You are here because something is going wrong and we need to change how you're approaching life maybe, or how these symptoms are impacting your life. And psychotherapy plays such a huge role in that. So I encourage psychotherapy, taking a step back, assessing your relationships, addressing sleep, doing trauma work if it's necessary. It's all encompassing. So that's typically what I find moves the needle, is when someone is really ready to attack their symptoms at all
Areas.
Yeah, exactly, with multiple modalities.
Yeah. And I think that's also important for people to hear too. I think we live in a world right now where everybody wants a quick fix for their problem. The area of mental health can be quite delicate, but also can incorporate many different aspects of your life. So I think it's great to hear from your lens that even if there is medication that's helping, and maybe everybody is completely individual, which is why I think there's no one size fits all, right? It's good to hear that medication does help in some cases, but that you're also looking at each person as a whole to say, okay, this is maybe going to help move you in the right direction, but it's not going to completely correct all of the symptoms. It does take some conscious effort and some work. And I love hearing, I know that you also have therapists in your practice, which is really important to have people right there that are just like a trusted team that you can say, here is somebody who could be great for you to speak to. It's important. And it does take a lot of work and putting yourself in the driver's seat also as the patient and developing that trust, I think, with the right practitioner. So I figured that question was going to be a little, hard to answer in totality, but I think it's important to be addressed. So for somebody who has never heard of TMS, can you talk to us about it and how does it work on the brain? And then also just to add a layer, how did that even come into your world? Where did you learn about it? And what made you think, oh, this could be a really helpful therapy to integrate into my practice?
So I'll start with that question. I mean, TMS really is something that in school we kind of skimmed over, like, this is a treatment some people use for depression. And that was like kind of it. There was no class about it. There was no, honestly, like not even a day dedicated to TMS. I didn't learn about it in school. I did learn a little bit more about it when I was working on the inpatient mental health units, because patients would come in that had tried it, or at one of the hospitals that I worked at, we actually offered it as a treatment. But it's really not talked about, which was fascinating to me. I was like, why? And that's what so many of my patients, after I have conversations with them about it, they're like, why haven't I heard of this? Which
Yeah.
is scary for patients as well, but also it just seems when you're talking about it, and we'll get into the weeds, it kind of seems too good to be true. And you're like, why isn't this everywhere? And it's interesting. I've talked to psychiatrists as well that confirm that it's not something that's talked about in med school either. So it's not, you really have to learn about it on your own.
Yeah.
So, you know, to be quite frank, a salesperson walked into my office and, wanted to sell me a TMS chair. And, I have salespeople come in all the time, people promoting medications. So it was kind of just another thing. But what was different was that he had so much data on the success
Mm.
of TMS. And so that really piqued my interest. And I know it's so funny how things align, but I was staying with you when I had become like, when I was researching this. And so I know we had conversations about it. And what was really selling me was the data. I'm data driven. There's so much success in clinical trials, and we could have a huge conversation about the FDA and the good, the bad, the ugly, but the FDA has approved this treatment. And in order to get an FDA approval, the data has to be there, the success has to be there. And really that's what I saw. So, because of that, I started to do a lot more research. I went to a program that NeuroStar, the company that my chair is from, put on, and learned about the success of the treatment, and really just took a deep dive into TMS. And I would say, I've found in doing TMS and being in this world is that it's sadly, it hasn't been talked about as much because it's an expensive treatment and insurance just started covering it. I accept a lot of insurances that do cover the treatment so that it's not a huge cost to patients now, which is amazing. But it's been around for a long time. And in the past, it definitely wasn't talked about because most people couldn't afford it. But also, it's not a pharmaceutical. So it really doesn't make a ton of money. And at the end of the day, that's what our society is, that's what we do. What our society is kind of focused on is making a ton of money, and this is not something that you have to do or take every day for all of time. And it's kind of just like you buy the chair and then the treatments are in your hands. So there's not a pharmaceutical company behind it making money every time the patient does this. So that, I know that's like, we're getting into territory of,
It's
controversial, but like at the end of the day, that's really why it's not talked about that much and why it's not as out there. Long-winded answer for that.
Yeah, no, all good. I mean, I think people, that is something that's important to bring up. And I think the more that I get into these conversations with people, in the world of integrative health, so many of these aspects aren't covered by insurance. So I'm happy to hear that TMS is something that, because of all the data out there, because of all the research that's been done, and because of all the proof, it was able to get FDA clearance and, have this is an opportunity for people now who, and we can talk about that process, are able to get that covered, because I think, not everybody has the resources to do that. It makes sense why that's not being talked about for all the reasons you just mentioned. But, that's the reason why we're having this conversation, to shine some light on that and maybe open up some doors for people to learn all about this who are looking for solutions that they're not able to easily find talking to their provider. So
yeah, I completely agree. And I do think, as you've seen in the oncology world, I think just the way that the way that we were raised, the way that we carry ourselves, like integrative medicine is really coming to the forefront. And so that's something even before before I was considering TMS, that's something that I've always been really interested in. And I've taken classes on integrative medicine as far as like supplementation for psychiatry and nutrition and all of that. And so this, this was just another modality for me to offer my patients that didn't have success with medications or maybe didn't even want to be on medications. And it's so exciting to me that psychiatry is now opening this vast world in integrative psychiatry. And not only is it becoming huge and talked about, but it's successful. Like people are having so much success with integrative psychiatry. So that really piqued my interest as well in incorporating this.
Love it. So tell us a bit about what transcranial magnetic stimulation therapy is and how it works on the brain.
Sure. So it is a non-invasive neuromodulation of the brain. Essentially, non-invasive meaning you're not put under, you don't need anesthesia for it, you're not getting any IVs, needles, nothing. It's completely non-invasive. We'll get into what treatment looks like, but it doesn't impact you cognitively at all. So as far as a patient is concerned, it's a pretty easy treatment. So we use magnetic pulses that stimulate the brain. It depends on the region, it depends on the symptoms that you're treating, determine what brain region is involved. But you're stimulating specific brain regions by magnetic pulses. So think like an MRI.
Okay.
Not a shock. A lot of people come into this thing, thinking it's like ECT, which is electroconvulsive therapy, where you're shocking the brain. It's not that. The modulation is caused by these magnetic pulses. So the belief behind it is, I'll take depression, for example, like the belief behind depression, and you can see this in PET scans, and I'm happy to provide a picture of that, is that like in a depressed brain, certain circuits in the brain become underactive or dysregulated. So that repetitive stimulation of the magnets that we deliver with the TMS machine provides like a wake up and a rebalance of those networks. So it's teaching your neurons how to fire correctly when they've been underactive.
So interesting.
The idea behind it is essentially we hear a lot about neuroplasticity these days, and that's a huge buzzword in TMS because it's increasing the brain's neuroplasticity by these magnetic pulses. And for anybody that doesn't know, neuroplasticity is essentially the brain's ability to reorganize and form new neural connections. So neuroplasticity allows your brain to adapt to new experiences, continue learning. Healing essentially is your brain's ability to rewire itself. And some people's brain is not, some people are able to do that as well as others. And in depression, you see that neuroplasticity really go down, and the TMS can help awaken that and improve that. Essentially, we say to our patients all the time, it's like physical therapy for the brain. We're teaching it how to rewire itself and fire more effectively than it was before.
That is so cool. And so can you see that? Because I know you had said there's a bit of a brain mapping that happens in the initial session, but as you are continuing these treatments and continuing to see people, make improvements, are you able to see that activity as you continue the sessions?
I wish that I could. And, I think you could do PET scans throughout, but that would be invasive. That would be time consuming. That would be expensive. So, you don't have to diagnostically, if you're coming to me with depression symptoms and I'm diagnosing you with depression, I don't have to then send you to a hospital to get a PET scan to confirm your brain is underactive to start treatment. It would be so cool if we could actually see that happening as we do the treatment, but it's not something that is practiced with TMS. Because
maybe we'll get there in the future. Who knows?
Yeah, I mean it could, but I think because of the time commitment of what that would entail and the expense of getting those scans, you kind of just go from the data of how much better a patient is feeling.
Yeah.
So the mapping doesn't go by scans. You can do MRIs. I know there are some offices that do MRIs to be more specific in the brain mapping, depending on what they're treating. Not many places do that though, because you're able to map the brain pretty easily with the with the TMS machine.
Mm-hmm.
Just a short version of that and what a patient can expect in a mapping appointment. It takes about 45 minutes. And what we're doing is we're treating the dorsolateral prefrontal cortex. So the way that we find, that's on the left side of your brain, kind of like it's different for everybody, but right along the hairline. So you'll see the coil in the pictures that I'll give you, the coil that we place on the head that provides those magnetic pulses goes right there where we find the dorsolateral prefrontal cortex. And the way that we find that is by stimulating the motor cortex. And in my specific machine, what we're looking for on the motor cortex is the reflex that moves your thumb. It's very cool to see. So just like you go to the doctor and they test your reflexes by hitting your knee and it moves your foot, we're delivering those magnetic pulses to your motor cortex, and we're looking for the specific region on your motor cortex that moves your thumb involuntarily, and then we move 5 centimeters anteriorly or forward from that, and that's where we administer the treatment on your dorsolateral prefrontal.
So interesting. So I know you said this is like electromagnetic stimulation. Can people feel it? I'm sure maybe it's different from person to person, but is there a sensation that people can expect when they're sitting in the chair?
You definitely can feel it. So we call it tapping. That's like really what it feels like someone is tapping on your scalp. It should not be painful, but it can be uncomfortable just depending on the thickness of your scalp, the stimulation that you've had there before. Most people aren't stimulating their scalp on a daily basis, so it is a feeling that not many people are used to having. So typically in the first week or two, it can be an adjustment period. We'll say that it feels really like, someone described it to me as like, remember Snapple, like the Snapple caps that are popping? It's almost like someone's doing that on your head. And so because the scalp isn't something that's stimulated a lot, it can be more sensitive for people. And the number one side effect for it is scalp discomfort and a little bit of headache. That typically goes away within 1 to 2 weeks of the treatment. So you can feel it. And we have people come in and, put their hand on the machine and they can feel it tap on their hand or on their arm so they can see what it would feel like. But it's certainly not scary, and it should not ever be painful.
Yeah. Okay. That's good to know. Yeah. And the fact that it's not invasive, it's doesn't sound like it's terribly time consuming. So the first session, it sounds like, is that 45 minutes where you're mapping the brain. And then is there a set amount of sessions that you recommend to people? Does that differ from person to person depending on their situation? What do the follow-up sessions look like?
So it really does differ from person to person, and it differs by what you're treating.
Okay.
What diagnosis you're treating and how. So depression being the most common is 36 treatments, 5 days a week. So you're coming for about 7 weeks, 5 days a week for 20 minutes. After you do that initial mapping treatment, the daily treatment is 20 minutes long. So that's typically the biggest selling point for people and the hardest thing to wrap your head around every single day coming in. But because it doesn't impact you cognitively, you can drive to the appointment, you can drive from the appointment, you can come on your lunch break, you can come before work, after work, you can go to the gym afterwards, you can go out and do whatever you need to do. It really isn't disruptive, but it is a commitment for that 20 minutes every day. The recommended sessions, the 36 sessions, that's what they were doing in clinical trials. So that's the number that you'll see most places for TMS. A lot of people they'll have success there and sometimes only need to do one course of treatment of the 36 sessions and remain, in remission with their symptoms well managed. Some people will come back after if their symptoms come back and they need another session of the 36 treatments. It really is patient dependent. I've had a couple patients that we've asked insurance to pay for an extra 10 after the 36 because they've had response, but they want to keep going because they want to see how much better they can feel after that. So unfortunately, it is patient dependent, but you'll hear that 36 number because that was what was in clinical trials. And that, in my opinion, that's the minimum that you want to do. If someone's starting to feel better around session 20 and they're like, all right, I'm good to go, I'm going to, stop coming here every day, I always try and convince them to get to that full 36 just to really solidify.
Yeah. Okay. Yeah. I mean, to me, it's like you can, so many people want to see the finish line, right? It's like they want to know, what can I expect? How long is this going to take? What's involved? And I think we're doing a really good job painting that picture. You're there 5 days a week, you're there for 7 weeks minimum. But during that time, I'm sure people are noticing changes. So, and again, this is on average, right? Because no one person is the same. But at what point on average in your practice and the people that you've given this treatment to, are you starting to notice people see a reduction in symptoms or an improvement in, any type of area and how they're feeling? How long does that normally take to onset?
So if you look at the 7 weeks of the treatment, again, very patient dependent, but typically we see people start to notice differences between week 3 and 4.
Okay.
It does take a little bit of time, and that can be frustrating, especially it's just like medications. People will take a medication. They're like, why don't I feel better yet? And it takes time. It takes consistency. So around week 3 or 4, sometimes as early as week 2 or 3, and sometimes this can happen late around week 5 or 6. The first symptom that we typically notice is improvement in sleep.
Mm.
And it's huge for people. I mean, a lot of people that suffer from depression sleep too much. They'll say they sleep 12 to 14 hours a night. It's never enough. They're napping throughout the day. Their energy is still low. And so we'll see that window shortens for people that are reporting that, and that they're having more energy with less sleep, or with like a typical amount of sleep that's needed. For me, I've had multiple patients that I've been treating for a while that have not slept well. And I mean, 2 to 3 hours of broken sleep every night, causing significant impact to energy, motivation, as you can imagine. Nightmares from trauma or PTSD, and the first symptom that they noticed was improvement in their sleep. 2 patients that we started right away were patients that were sleeping 2 to 3 hours a night, and both of them actually had to move their TMS appointments that they were scheduling for like 8, 9 in the morning, because they were sleeping through their appointments, which they had never had to set alarms before,
Yeah.
because their sleep was so broken and so bad. So that was like magical for me when I first started treating patients, seeing the impact of sleep, because I am someone that like drills how important sleep is. It impacts everything, as you know. And then mood symptoms, honestly, it is similar to taking medication. I tell people, you're going to, if you do see improvement by taking this medication, you're not going to be skipping through fields and thinking, life is great. It's not going to be this grand difference, but things are going to feel lighter. The symptoms that were weighing you down are going to feel lighter, and those take time to notice, and they evolve over time as well. So typically, our TMS tech that administers the treatment, she'll start to notice things before even the patient does. Like they're more talkative in their session. They're not watching TV or on their phone. They're actually talking to her and telling her about their day, or they'll notice that they, like I have said, they have more motivation. They'll start going to the gym or going for walks that they didn't have the energy to do before. A lot of family members start to notice as well. I had a patient that said her mom was like, "You've been out of your room every night. You come out and you eat dinner and you don't go back in your room," which is like, not something you might think about for yourself, but she didn't feel the need to isolate because of how she was feeling. She wanted to be around her family and socialize. So little things start to appear towards those like last weeks.
I mean, I love to hear that. And to me, it's like we know that even though these may feel like little things, they yield such big results. I mean, the sleep alone is huge. It affects everything. And I'm sure that's got to be such a great feeling for people to see that difference, and then the ripple effect it has on your entire next day. But even, these small, tiny things like not wanting to isolate, being more talkative, like integrating themselves more into the world around them is huge. So I love to hear that. And it makes sense, right? I don't think there's any magic bullet in situations like this where you're on a healing journey that can feel pretty significant. But it is also encouraging to hear that you're seeing that progress maybe even by like the midway point, or again, I'm sure everybody's a little bit different, so maybe some people are seeing it sooner, but that is so huge. Do you encourage people to, because I know you mentioned your technician can sometimes notice it before the patients themselves are actually able to, speak it into existence or like self-reflect. Do you encourage people to keep journals or any type of, documentation of how they're feeling in this process? I'm sure maybe they're already doing it, but once they start this treatment specifically to notice their own progress.
Love when patients keep journals of it. I love that. And some people, it's hard sometimes to get people to do that, especially, if you think about it, they're coming to you very low energy, unmotivated. It can seem like a really big task to do that. So it's not something that I require. It's something that I definitely encourage. There's lots of like Reddit threads and YouTube videos out there of people that have documented like with videos day one of starting TMS, and then they document the whole thing. Unbelievable when you can just see it in their face and how their demeanor changes. So yes, I definitely encourage people to keep a journal or keep track of it in some way. Not all do, but what we do in my practice is we measure depression symptoms with what's called the PHQ-9. It's the Patient Health Questionnaire, and they say 9 because there's 9 questions. And most of us have actually taken this questionnaire unknowingly. A lot of PCPs offer it when you go get your physical. They ask you questions about your mood and how you're feeling and your sleep, and that's what the PHQ-9 is. So that's how we measure, so that we can have tangible data on our end. And it is very subjective, but that's where we start, and the patient will start at a certain score, which usually indicates moderate to severe depression. And then we track by sending that to the patient every 2 weeks to fill out throughout their experience to see just on paper if the symptoms are getting better.
Yeah. Awesome. I love to hear that. So let's talk a little bit about who might be an ideal candidate for TMS, because I know you and I have had some conversations about it. I know it's at a point where it is now approved by insurance. So is there a qualification process patient might need to go through, or certain things that need to be met before they can start this treatment? Can you talk to us more about that?
An ideal candidate, if we're just talking about depression, is somebody with moderate to severe depression who has not had success with medications. For insurance, to get insurance approval, it really depends on the insurance, but as a blanket statement, most insurances require the trial and failure of 2 antidepressant medications. So you have to, which like anyone with depression and anxiety can usually say that they've done this, that they've tried and failed at least 2 medications. Some patients have lists that are very long, but most people have met that requirement.
Okay.
So yeah, that's what they're looking for, is the trial and failure of two or more, and that's when they'll pay for the treatment.
Okay. And is there a certain window of time that these patients would have had to like trial and error the medication? Is it like, okay, if you've had a history of being on, this SSRI for 6 months without any improvement in symptoms, or, is there any threshold of time that they qualify?
So again, it depends on the insurance. They can be pretty nitpicky. If I have someone, just for example, like Lexapro, usually the max dose of Lexapro is 20 milligrams, and you want to be on, so they're looking for a therapeutic max dose for a sustained period of time, because these medications can take a little bit to work. So if you're saying that a patient was on Lexapro for a month and they got up to 10 milligrams and they didn't discontinue it because of side effects or anything, it just didn't work, then they could argue that you didn't get it to a therapeutic dose and the patient didn't try it long enough, and that trial doesn't count. If they had side effects though, and that's why they came off the medication, that counts. They tried and failed because of side effects. Yeah.
Okay. That makes sense. Now, I know I have kind of guided this conversation to talk more specifically about like anxiety, and really more so depression and a little bit of anxiety, but are there other diagnoses that TMS can help treat?
So this is like such an exciting question for me right now. And what I focus on is depression and OCD, because that's what my machine is FDA approved to treat, is adult depression and OCD and adolescent depression. So for adolescents, which is anyone 15 into 18, it's first line. So I'm sorry, I misspoke in my last answer. That insurance criteria is for adults.
Okay.
For adolescents, this is FDA approved as a first line treatment. So children ages 15 to 18 do not have to have trialed any medications. They can go right to TMS, which is really saying something. There are only 2 antidepressant medications that are approved, that are FDA approved for the treatment of depression in adolescents. And both of them come with a black box warning of suicidal ideation, which is really scary for a patient, for a parent, seeing this black box warning that starting this medication could increase or cause suicidal ideation in some patients that are already having suicidal ideation. Super scary. So that's very exciting that it's first line. We don't have to argue anything. They can just jump right into it. There are indications and FDA approvals with some machines for the treatment of migraines, and there are many, many clinical trials for non-FDA and off-label treatments of addiction, fibromyalgia, neuropathy, the trials on dementia and Alzheimer's, not for cure, but treatment in slowing down the symptoms. Are really promising and really exciting. So there's lots going on in the world of TMS as far as clinical trials are concerned, and there are a lot of practices that are using it for off-label treatment for a lot of these things. Mine just isn't one of them. I'm still brand new baby in this TMS world, so I'm just using it for the FDA indications of depression, OCD, and adolescent depression.
Fair enough. But that is really exciting and also fascinating to hear how many things it can potentially help with. And, the fact that there are clinical trials going on, I'm sure more and more research will prove that this is a great therapy that can surely help with all of those things.
Yeah, it's really exciting.
Awesome. So what would you say is the biggest advantage of using a TMS machine for something like depression compared to antidepressants? I feel like even asking that question, I can certainly come up with some answers, but in your opinion, what would you say the biggest advantages are?
Oh, goodness. I mean, side effects, I would say, is the biggest advantage. When you're taking a medication, it has a systemic impact on your body. So, and I feel like such a snake oil salesman when I talk about TMS and the side effects, but there are essentially none. And I'll go over those. But for antidepressants, a lot of people stop them because of the side effects. Unfortunately, people will see results and they will feel better, but they're having sexual side effects, which really impacts your life on a daily basis, or they're having mood dulling or mood flattening, which sounds a little counterintuitive when you're treating depression, but having a flat mood comparatively to a depressed mood is better, but not where you want to be, not where you want to live.
Right.
I could go on and on. There are lots of side effects. And like I said, the black box warning of increased suicidal thoughts. So the advantage of doing TMS versus medication is, I would say, the biggest is the avoidance of side effects. And for TMS, the most reported side effect is that scalp tenderness and headache, usually in the first 1 to 2 weeks. And then there's a 0.1% risk of seizure. So the risk is very low. And because of that risk, even though it is low, it's something that we assess for daily in the treatments, but of course before, when we're determining if someone is a good candidate for TMS.
Okay. And that scalp discomfort, just to go back to that, is that something that people are typically feeling only while they're in the chair going through treatment, or that's something that continues after that's happening in between sessions?
I've heard both. I mean, it's typically just during the session, and then a headache might come after because of the discomfort. But it's typically taken care of if someone feels comfortable taking Tylenol or ibuprofen. It can be resolved doing that. I've had people that are like, yeah, I have this dull headache, but it's not too bad. And then it goes away within that first 1 to 2 weeks as you're acclimating to the treatment.
Yeah. Wonderful. And I don't think we got to this question, but now that I'm kind of thinking through all this, is there typically, let's say after, and I know everything is completely dependent on the individual. But let's say somebody finishes those 36 sessions and they are feeling like they're in a really great place. But, let's say maybe a year out, they decide to come back. They want to, just for some maintenance.
Mm-hmm.
Are those treatments cumulative over time, or is it something where it's helping resolve in the moment while you're going through those sessions and then things kind of taper off? I don't know if you can answer that question easily, but.
So it is patient dependent. Like I said, I have had people that have gotten this treatment one time and they have success and they have, continued success and don't need to come back. I have also had patients that they have success while they're getting the treatment a couple months after, and then symptoms return and they come back for more treatment. A lot of people find a sweet spot after like 2 or 3 full sessions, especially with really severe depression. But the thing is that's great about it is that neuroplasticity. I equate it to, like I said, physical therapy. You're teaching your muscle to perform in a certain way, and you need to do that repetitively. And after you go to physical therapy, after you complete your 8 weeks or whatever that is, you might need to go back. Your shoulder might start hurting again, or you're not doing the stretches as often. But most people experience that neuroplasticity so that when they do come back, their symptoms aren't as bad as when they first came back, but it is lasting. The durability of it is there, and that the evidence of that is in the clinical trials for sure. So I know that's like a answer that most people hate hearing, that it's patient dependent, but I've seen one session of the 36 treatments do its thing, and then some people need a couple more.
Yeah. I think that's encouraging to hear, honestly. Yes, everybody's different, but there are clinical trials and research out there that are looking at the general trends among so many people. So the likelihood of this being successful over time and maybe you not needing to go back are certainly possible. I'm sitting here like, oh my God, it's good for neuropathy too. Like maybe I need to hop in a chair.
And what I always equate it to, because obviously my patients are coming to me for medication management. You're taking a medication every day. When you stop that medication, it stops doing its thing. It stops it, and it's not something that continues like this is. Like this is actually training your brain to function correctly. Medication is not doing that.
Yeah. That's huge.
Mm.
So amazing. Let me see. I'm just looking through. I feel like we've answered a lot of these questions. Are you able to share a specific, if you can, while also maintaining confidentiality of your patients, are you able to share a success story with TMS?
Yeah, absolutely. And I think she would be happy for me to share this story, honestly. And I won't use her name. Interestingly enough, this patient came to me. She's a 24-year-old female. She came to me as not a patient at my practice, had not been seeing me for medication management. Just quick Google search found that I was doing TMS. Her mom had done the research. So she came in. She scored a 22 on her PHQ-9. It scored out of 27. So 22 out of 27 indicates severe depression. She was on 225 milligrams of Effexor, which is venlafaxine, an antidepressant medication that she felt she had been on it for 2 years, wasn't working for her. She kind of questioned if it ever had. She had tried a few before that, but she had low energy, low motivation, was trying to get her degree, which was extremely difficult for her because of her symptoms. This was one of my patients that was sleeping 2 to 4 hours, broken sleep a night. Her relationships were really struggling, and that was her biggest issue. She said that she couldn't have any friendships or any intimate relationships because of how her mood would impact those relationships, and she just felt like she couldn't keep anyone in her life. And she had really, really pervasive suicidal thoughts, and she was self-harming almost every day by cutting herself. So this was my third patient that I treated at my practice. I was very nervous because I really didn't know her. She wasn't,
Right.
like I said, she wasn't one of my patients that I had been working with for a while. She showed such improvements. This was really the moment for me that I was like, obviously I've seen the clinical data. That's the whole reason why I got on board with this, but seeing it live
yourself.
was so different. So about halfway through the treatment, she was sleeping through the night for the first time, and she couldn't even remember how long. And so she was the one that she started sleeping through her appointments, and so she had to change her treatments to later in the day because she was sleeping in for the first. And then by the end of her treatment, her motivation had completely changed. She was getting straight A's. She was getting her homework done. She told me for the first time in months, she could see her floor in her room. And that was something that her mom noticed. Like she had energy to clean her room. She had the motivation to clean her room. She wanted to take care of herself and her hygiene, which also that was something that our tech noticed, when she first started. Her hair would be a little disheveled. She didn't smell, but, maybe hadn't showered in a couple of days. She was coming in pajamas, and towards the end of the treatments, she had makeup on. She had, clothes on, not pajamas. Her hair was done. So visibly, you could really see the changes.
Yeah.
And, on top of all of that, which was huge for me, her suicidal ideation had completely gone away. She, to this day, has not self-harmed for over 8 months. And we have successfully tapered her venlafaxine to 0 milligrams a day. And she is now currently only taking medication for ADHD and is still feeling amazing daily. Her PHQ-9 score went down to a 5, which still indicates mild depression, but a 4 or less is remission.
Wow.
So
from a 22 to a 5, that is a huge change.
Yeah. So she is seeing me now for medication management. She did stay with our practice, which is great because I can, keep an eye on her, make sure she's still doing okay. And we're months out and she's still doing incredibly well and still just on ADHD medication.
That is such an amazing success story.
Incredible. It really has, it's kind of awakened, the passion in me again. And just seeing, she had been suffering for so long and kind of was just like, it's as good as it's going to get. The effects of what had worked the best for her, but still, she was still a 22 on her PHQ-9, still self-harming. So just seeing those results, it was amazing. I have few words.
I have the chills because that is so life-changing, and what a transformation even just for you and your team to visibly watch, but then to hear all of these things that she's changing in her life, and to hear that I'm glad to hear that she's still with your team so you can keep in touch with her, but what a 180 it sounds like from where she was when she first walked through your doors.
Yeah.
So I love to hear that.
Incredible. Just incredible.
Okay, thank you for sharing that. That. So let's see here. I know, as you alluded to in the beginning, that there are also a lot of things outside of, medication or even something like the TMS therapy that can help people improve their mental health. And I know that is a lens that you also personally find importance in, but I'm sure it's also, as you alluded to, like a way that you communicate with your patients, things that they can do to help them stay in a good place or to help improve the outcome of what they're already doing by working with your team and your practice. So can you talk to us a little bit about that? What foundational habits matter most when it comes to lifestyle? Where maybe like top 3 things that you would encourage people to focus on?
So I want to just first say that this is, when it comes to mental health, I feel like this is something that I preach, those foundation matters. Absolutely. And I talk about this in every appointment. I ask questions about everything that's going on in people's lives so that I can have a big holistic picture and, talk about what we can do to make those things better outside of medication. But I will say, I hear from a lot of people who have had the privilege to maybe not have anyone suffering from any mental health disorders in their family or haven't gone through it themselves that are like, just exercise, the dopamine, just go to the gym, go for a walk, for my eating disorder patient, just eat a cheeseburger, like really simplifying it. And so that's why I kind of want to just start off by saying for a lot of these patients, it's not that easy. They wish that they could go to the gym or they could just go for a walk because they know the healing power of the sun and what exercise can do for you. But when you are so severely depressed that getting out of bed feels like the greatest task that you're going to accomplish that day, sometimes getting out of bed is the only thing you can do if you can do that. So a lot of the times, TMS or medication is getting you to a point where you can actually have that little bit of motivation to start doing the foundational things. And so I think that really plays a role in the success of both of medication, psychotherapy, TMS, all of the things, because once you get that energy and motivation back a little bit and you can foster creating the habits and those foundational things, that's when you can kind of carry your success and continue your success. So that being said, I would say the three most important foundational things that I preach and talk about with my patients every single appointment is sleep, the importance of sleep. I hone in on that. I ask about it every single appointment. What is your sleep hygiene like? Not just like how many hours are you sleeping? Is it broken or unbroken? What are you doing before bed? What kind of environment are you creating for yourself to promote relaxation? What time are you going to bed? What are you taking in as far as media and
Yes.
all of those, so many things impact that. So sleep is not just like, are you sleeping? How many hours? There's so many things that go into that, which I call sleep hygiene. So that's number one. I'm big on sunlight. That's a huge one for me, especially in the Northeast. I do see the impacts of seasonal depression living in Boston and growing up in New York, where it's like gray for 6 months out of the year and cold. Sun isn't there. And my patients, a lot of them think that I'm crazy. I'm like, it's, the dead of winter and it seems like the sun isn't there, but I'm preaching, just go outside. I know it's cold and I know it seems like the sun isn't there, but just go outside, sit there for 15 minutes. You have no idea what it'll do for your health. So sleep, sun, and therapy. Therapy is big for me as well. I've seen it move the needle and it's not easy. A lot of people have trouble finding a therapist that works for them, which I think is, a lot of people need to know that that's completely normal. I always say therapy is like dating. You got to find someone that works for you, that challenges you, that you feel comfortable with. But when you do find that person and that therapeutic relationship, it can be life-changing.
Amen to all of that. And it's such a great reminder for people, whether you are having trouble with your mental health or not. These are foundational things that I think across the board that will make a difference in everybody's life. I know that, getting outside has actually been really hard for me lately because it's been so cold, but I know the difference that it makes, even, and I was talking to the doctor in Buffalo that I worked with a couple of years ago. He's like, even getting one of those artificial sunlight lamps,
Happy light.
the happy light, can make a huge difference.
Yeah.
So that's something I'm thinking about too. But all these little shifts and being willing and open to start. And I love, the disclosure that you gave in the beginning that for some people who are feeling these severe symptoms of depression, it is a huge effort to think about making these changes. So you need to start small and you need to work with people who will help encourage that. And I do think it's a great complement to some of the things that you work on in your practice, whether that is getting people on medication and seeing the improvement there, or getting them in the TMS chair and seeing improvement there. Then that's maybe when you enhance all of those efforts with some of these lifestyle shifts. So Thank you for sharing that. Hugely important. Yeah, I guess in terms of the future and your practice, but also the future of mental health, and it's 11:07.
We're good.
Are you okay with 2 more questions? Okay. So in terms of how the TMS machine is shaping the future of your practice, but also the future of mental health and talking about some of these integrative things that we've brought up in this conversation, where do you feel like the category of mental health is moving in the future?
I would say, my hope always is that, I think that we are so lucky to live in a time where mental health is at the forefront of conversations and people are really talking about it a lot more than they used to. I think that's huge. So I'm hoping that continues to be the evolution of mental health. And I think that medications are very stigmatized still. I think that therapy is very stigmatized still. So I'm hoping that that continues to evolve and people can talk about it more openly. And I think that this integrative side of psychiatry can kind of ease that stigma a little bit, in that, if people are scared of medication or have had bad experience with medication, this offers another intervention that seems hopeful. And like I said, throughout this, and I know in the beginning, there's data there that it works. It's not just some woo woo thing that people are trying. There's actual clinical data there that works. There's actual, there's hundreds of thousands of people that have done this that are out there on the internet that you can see their testimonials of it working. So my hope is that that continues to evolve and that just continues to become more accessible for people in more ways than one.
Yeah, very well said. And I do agree. Just to double tap on that, we are living in a world where information sometimes can feel overwhelming. Like we're in a world of information overload, but having access to even this conversation to open the door to somebody who may not think that there are other solutions out there for helping themselves is huge. And so I love that. I love everything that this conversation has brought us here in this space. And I just want to ask if you think we left anything out that would be important to share.
Well, I wanted to add to that in that, I think that this TMS specifically is changing the way that I practice, in that instead of just trying medications and kind of throwing a dart at a dartboard and, okay, this didn't work, let's try another one, or let's add this on. It's really helping. It's another intervention that I can offer for my patients. So it's changing the way that I practice in that regard. And I think it's changing the way that a lot of prescribers are practicing, as far as avoiding polypharmacy and just, like I said, just trying multiple medications without it working. So I would add that. I think that it's important for people to know that they are the driver of their health. And if this sounds like a treatment that could work for them or work for somebody that they know, you can request a consultation from somebody. Walking through the door of a practice or getting a phone consultation doesn't mean that you're committing to anything. You can learn from the provider. You can get the vibe of the practice that you might be going to every day, which I think is so important to feel comfortable. But you're in the driver's seat. If this sounds something that you would be interested in, go ask questions, go find out. It doesn't mean that you're committing to anything.
Great point. Yes, I think if you are listening to this conversation and feeling curious, I would actually, and I will include this in the episode notes as well. I'm assuming that NeuroStar has a site where people can go and search for TMS machines in their area. Is that?
Yep. So NeuroStar is the TMS machine that's in my office. There are lots of TMS machines out there on the market. I'm obviously biased because this is the one that I use and I've seen great results. And they themselves, just NeuroStar alone, has tons of data just on their machines. 83% effective.
Wow.
Crazy stat. Over hundreds of thousands of patients in that clinical study. Just going to throw that in there. But yes, their website, I believe it's neurostar.com, pretty straightforward. They actually have a search bar. It says find a doctor near me or find a provider near me. And you can put in your zip code and also your insurance so that you can find clinics that accept your insurance and are near you. And then they also bring it up another level if they ask you a question based on response time of the practice. So they will actually vet certain practices that if you call this practice, they will contact you within a day. So your call, a lot of people find, I've had a lot of patients say, I called the therapist, I called the whole list, I went down a whole Rolodex and nobody called me back. So if you check that
yeah.
Which, it's devastating to me, someone's putting in that effort and that happens. But if you are making the effort to go to this website and you are feeling depressed, it takes so much effort to even do that for some people. NeuroStar is promising you that they can connect you with a practice that's going to call you back within a reasonable amount of time, like 24 hours.
Wow. I mean, I think you and I could talk for a while, and I'm not going to take us down that rabbit hole, but I know that NeuroStar has been incredible to you. they seem like they are just a business that thinks about every aspect from patient care to the practice and how they work with you, integrating all of that into, your space and making you feel comfortable. But also it's like even something like that, making the patients feel comfortable in their response time. I mean, they're very thorough and well thought out, and, it shows.
Yeah, I love working with them. It's been such a great experience, and they really do care about the patient experience, which is
very
fantastic.
evident. Yeah. Okay, so I will make sure to include that in the show notes. Yeah, thank you. I mean, this is so wonderful. I think it's a very important conversation to have. It's a very important topic. It's something that I think was maybe taboo years ago for a long time, but I think more and more people are starting to feel more comfortable having conversations around mental health, and a solution like this can be such a game changer. And I'm really proud of you and so happy to hear that wonderful success story. And I'm sure there are so many more that are continuing to happen across the board.
Thank you so much for having me. I just love having the opportunity to talk about it. I know I'm, like I said, kind of a baby in this TMS game, but I am learning every day. I love talking about it, and I just want people to know that it exists, not even at my practice, but just as an intervention for anybody that is suffering, because I really just believe wholeheartedly in this treatment. Just enjoy talking about it. So I appreciate you giving me the opportunity to do that.
Yeah, I'm so happy we made this happen. One final question that I ask everybody who comes onto the podcast. You're on the Forward Think Tank. What is it that keeps you moving forward in life?
As an avid listener, I knew this question was coming.
That's an easy one to answer.
Lots of thought. Of course, my family keeps me moving forward. My friends keep me moving forward. Of course, the presence of my family and friends in my life every day is so motivating for me. But I did want to emphasize, I think what really motivates me and encourages me is everyone's ability to change and become a better version of themselves. And that is really something that motivates me in my business, motivates me in my life. I think just the two of us have seen so many versions of ourselves since we met I think we were like 18, 19 when we met. And to me, that's just like to learn from life's experiences and continue to work towards being the best person you can be is, like I said, so inspiring, so motivating. And being in this world, seeing my patients do this every day, they're coming to me with symptoms that are impacting their lives every single day. And they're willing to do this incredibly hard work of learning what's causing their symptoms, challenging themselves by learning and also making mistakes, coming back from setbacks, and life in general, just like being so hard. And witnessing that every day in my patients is definitely what keeps me going forward, and the hope of them evolving and changing and becoming better, and just the privilege of witnessing that.
So beautifully articulated, Han. We are all so lucky to have you as a friend, sister, daughter, as a practitioner, as somebody to help just guide us through life. I mean, I've seen, as you said, so many versions of you and witnessed all of your growth on this 20-year journey of our friendship. And you never cease to make me proud. And it's been an honor to have you here and have this conversation. So
that means so much coming from you. Thank you for having me.
I love you.
I love you too.
Did you enjoy this episode? If so, I would appreciate you taking a moment to please leave a 5-star review. Every review helps visibility with this episode to reach more people. And I am on a mission to help people learn alternate resources to support themselves in their healing journey on their road to health. So please take a moment to leave a review, leave a comment. I read every single one and I respond back. And of course, the most helpful thing you can do is to share this episode. If you found it helpful, if you found it entertaining, please share it on social media, send it to a friend, a loved one, someone you think could find this helpful. It means the absolute world to me. Thank you so much for being here. Thank you for listening, and I will see you soon.